Hi, I'm Emily Lynch. I'm going to be your nurse practitioner performing your physical assessment today. How are you feeling?
Good.
Did you empty your bladder before you came in?
I did.
Would you like a gown?
No thanks.
You're going to have to take your shirt off during a portion of the exam. Is that okay?
Yeah.
Alright. Can you stand up for me and go ahead and step on the scale? £175. Does that sound about right?
Yeah.
Go ahead and get your height. Okay, just stand right here for me. $5'7" sound about right?
Yeah.
Okay. You want to sit down and get some more of your vital signs? Just going to get your pulse ox and your heart rate. If you would just stick down your finger for me. %, heart rate's 62, does that sound right?
Yep.
It looks like your respirations are about 18. Go ahead and get your blood pressure. Just borrow this arm from you. Do you know what your blood pressure normally runs?
I don't.
(132/78). Alright, we'll go ahead and we'll get started with your exam here. Just going to move some of this stuff out of the way and bring over some other stuff. Okay. I'm going to go ahead and just examine your head first, okay? Eyes look symmetrical, ears look symmetrical, face is a normal color, no abnormal lesions, scarring, anything like that. Go ahead and feel your head first. Have you look down for me. No bumps or bruises, no tender spots. Correct? Nothing tender?
No.
Go ahead and feel your occipital lymph node. See if there's any swelling. If your lymph nodes are swollen, that can mean an infection. They're not swollen, it's not tender, correct?
Nope.
Okay, go ahead and look up. Your hair's no thinning, good texture. Looks like you have a little scar here. It's smooth. No hair growth over that. Did you already know about that, right?
Yeah.
Okay. Just gonna go ahead and I'm gonna feel your face bones. Go ahead and feel your temporomandibular joint. Can you open and close your mouth for me? A little bit of clicking there. Any pain?
No.
Okay. I'm going to go ahead and feel your sinuses. Maxillary, no tenderness.
No.
Frontal, no tenderness.
No.
Okay. Sphenoid and ethmoid sinuses, no tenderness.
No.
Alright, good. Go ahead and move on to your ears, okay? No lumps, no tenderness.
No.
Okay, we'll go ahead and look in them. I can visualize your temporal membrane. There's no discharge, no redness, no water. And same over here. You haven't had any tenderness in your ears, right?
No.
Okay. Come back over to your face here. I'm going to touch you with a cotton ball. Go ahead and close your eyes. When you feel me, go ahead and tell me that you feel me, okay?
I can feel that. Feel that. Can feel that. Can feel that. Can feel that. Can feel that.
Okay. That was just testing cranial nerve 5. We'll move on. I'll have make kind of some funny faces. Testing cranial number 5, 7, and 12. Okay. Can you smile real big for me? Clench your teeth. Stick your tongue out. Puff your cheeks out. Wrinkle your forehead. Scowl. Close your eyes. Good. Okay, we'll move on to your eyes. I'm going to go ahead and have you close them. I'm going to look and make sure your eyelashes, they look good. No swelling or discharge there. No redness. Just going to palpate your lacrimal apparatus. No tenderness there. Can you open your eyes while I do that again? No discharge. Alright. Just going to lift your eyelid up a little bit here. Look at your conjunctiva. Can you look up for me? And look down. Sorry, look down. There we go. No discharge. Down. No redness. Good. Looks good. I'm going to go ahead and move on. Look at your pupillary response. I'm going to dim the light a little bit. Bright light, okay? And just look at the wall. Good. Other eye. Good. One more time, okay? Perfect. Gonna have you follow this pen light with your eyes, okay? Perfect. I'm just going to cover one eye. I'm going to have you stare at a fixed point on the wall, okay? Okay, no abnormal movement. Same there. Another kind of bright light in your eyes, okay? We're going to perform a red reflex test. Look at your retina. Alright. Just going to kind of move in on you here. Just stare straight ahead. Looks good. Same thing over here, okay? I'm going to use my dominant eye here. Good. Alright, so everything checks out on your eyes. You haven't had any trouble seeing, correct?
No.
You don't wear glasses?
No.
Okay, good. We'll go ahead and we'll move on to your nose, okay? I'm just going to have you look up for me. Use the light here. Just going to look at your septum. Make sure there's no perforations. It looks midline. No discharge, no redness. Can I have you occlude one nostril and blow out? Same thing with the other one. Okay. Your nose been a little stuffy?
Yeah.
Okay.
Just woke up, so.
Alright, we'll go ahead and we'll examine your mouth, okay? I'm going to have you stick your tongue out and say, ah.
Ah.
I'm going to gag you just a little bit. We're testing cranial nerve 9 and 10 here, okay? Sorry. Just going to look in you. Can you say ah one more time just so I can see better? See your uvula. Looks like you still have your tonsils. Have all your own teeth. Everything looks pink and moist. No cracking, no sores. Same with your lips. Pink, moist. No cracking there. Okay. Just going to move on here to your shoulders. Test cranial nerve 11. Can I have you... Oh, we're going to do your ears. Okay, we're just going to do a little hearing test, a few things, okay? First, I'm going to strike this. Put it on top of your head here and tell me if you can hear it. Is it the same on both sides?
Yeah.
Okay. Same thing, other ears here. I'm going to put it behind your ear. I'm going to time it. It's air bone conduction. Okay? I'm going to put it back here. Tell me if you can hear it. And when you stop hearing it, say that you don't hear it anymore. We're going to move it to the front. Tell me when you stop hearing it in the front, okay?
Stop tearing it. Stop tearing it.
Okay.
Stop tearing it. Stop tearing it.
Alright, so that was the Weber and Ryan test. Just a little hearing test. We're going to do one more hearing test, okay, called the whisper test. I'm going to kind of occlude one ear, kind of wiggle my finger around, shouldn't hurt. I'm going to whisper a word, and you just tell me the word that I whispered, okay? I'll stand behind you here.
Cloudy.
Good. And same thing over here.
Rainy.
Good. Alright, now we'll move on, okay? Cranial nerve 11 is your shoulders. I'm going to have you push up against resistance, okay? Good. Can you push up without resistance? I'll make sure it's symmetrical. Good, no problems there, okay? We'll go ahead, we'll move on to your throat, alright? Just going to have you tip your head back. I'm going to look for your trachea here. I'm going to make sure it's midline. No swelling, no tenderness, and everything looks good there, okay? So we'll go ahead and we'll do your lymph nodes, alright? I'm going to feel back here behind your ear, post-auricular, pre-auricular, tonsillar, submental, submandibular. No tenderness on any of those. Okay, so we'll do the lymph nodes on your neck here. We'll do the posterior chain. Good. Can you look forward for me? Do deep cervical. And your anterior cervical. No tenderness there. Alright, at this time I'll ask you to take your shirt off, okay? We'll go ahead and we'll feel your subclavicular lymph nodes. No swelling, no tenderness.
Nope.
I'm going to kind of just have you put your arms out a little bit, and I'm going to feel for your lymph nodes in your axillary area. No tenderness, no swelling.
No.
Old surgical sites here.
Yeah.
Okay. So we'll move back up here, and we'll have you stand up. I'm going to have you turn towards this direction. I'm going to grab you a glass of water. And we're going to try to locate your thyroid. What I'm going to have you do is you'll take a drink of water and hold it in your mouth. Don't swallow until I tell you to, okay?
Yeah.
Alright, go ahead and swallow. Perfect. Okay, one more time. Swallow. Okay, good. Your thyroid's not enlarged. Okay, you can go ahead and sit back down for me. I'm just going to feel for your pulses. Good. Strong and regular on that side. And strong and regular on this side as well. So I'm just going to go ahead and take a listen to your thyroid and take a listen to your carotid arteries. First, I'm going to have you take a breath and hold it, okay? Good. And same, you can let that out. And same thing over here. And you can let that out. And that all sounds normal, okay? So we'll go ahead and we'll move on to your back, alright? Just going to kind of inspect your back. Make Make sure your skin looks normal. Even texture. No scarring, no bumps. Okay? Just going to kind of feel your cervical spine here and then feel all the way down your spine. Make sure it's straight. No tenderness?
Nope.
Alright. Good. We're going to go ahead and assess your costovertebral angle, okay? I'm going to palpate your kidneys here real quick. Good, and then the other one. Try not to lose my stethoscope. And there's no tenderness there, correct?
No.
Okay. You're going to feel kind of a little thump, alright? And tell me if you feel any tenderness with it.
Nope.
And same thing over here, okay?
Nope.
Alright, good. Okay. Just going to go ahead. I'm going to palpate through your back here. Through your lung fields. I don't feel any nodules. Feels like your respiratory rate's pretty regular. Kind of have to lift your arm up there. And those are old chest tube sites, correct?
Yeah. When I was born.
You have no residual issues with your lungs because of that.
Nope.
Alright, good. Okay. I'm going to have you do something for me here. I'm going to have you say 99 every time you feel my hands touch your back, okay?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Good. Okay, I'm just going to go ahead and percuss through your lung fields. Okay. Now you kind of lift your arm up a little bit. I'm going to do the same thing over here. Switch sides again. Okay. Okay. Okay, get over here. And same thing over here. Okay. Sounds good. We'll go ahead and take a listen to you, okay? Deep breath for me. Keep breathing. Go ahead and listen to the lateral side of your lungs. Just lift up for me there. Good, and the other side. Lift this arm up for me. Thank you. Deep breath. Breath. Okay, sounds clear. One last thing here. We'll kind of just have you take a deep breath for me. Can you sit straight for me? Thank you. Take a deep breath. Let it out. Same thing, deep breath and let it out. We'll go ahead and do your front here, okay? Kind of do the same things over again. We'll do that same tactile fremitus that we did in the front, the 99, 99, 99. Kind of tells if you have any consolidation, emphysema, pleural effusions, things like that, any other kind of respiratory issues. Your back's findings were normal, okay? So we'll start with that. Have you take a deep breath. Alright, look symmetrical. And same thing again. Just say 99 every time my palms touch you, okay?
99, 99, 99, 99, 99, 99.
Okay, we'll go to this one again, okay?
99.
Alright, good. We'll go ahead, we'll percuss through your lung fields again, okay? And we'll take a listen, okay? We're just making sure we don't hear any flatness or dullness on those percussions, okay? Just can indicate different kinds of respiratory diseases. You sounded normal. Deep breath. Deep breath. Alright, all those findings were normal, okay? We're going to go ahead and move on to your heart, alright?
Okay.
I'm just going to have you kind of straighten your shoulders up for me. And I'm just going to kind of palpate your heart's borders here. Make sure it seems to be the normal size. I don't see any abnormal thrills, heaves. Been kind of looking at that throughout the exam. Like I said, your respirations looked normal. Again, no heaves. Abnormal thrills. I'm going to locate your pulse down here, okay? Just kind of put your hand out for me. This is called your point of maximal impulse. If it were outside of the normal margins, we might think you had some kind of ventricle hypertrophy, but it appears to be normal, okay? So we'll take a listen to you. We'll just move through your different heart fields, okay? And we'll switch over to the bell side of my stethoscope. Just here's different pitches of heart sounds, okay? And again, the same places. Aortic. Can you relax that arm for me? Pulmonic. Herb's point. Tricuspid. And mitral. Your heart sounds are all normal. No bounding pulses or anything like that. So I think we're good there. Next, I'm just going to kind of inspect your arms. Just hold them out for me here, just like this. Good. Hair distribution is normal. Okay. Color is normal. We'll test your strength real quick. Just give me a squeeze. Okay, pull me towards you. Push me away. Good. Look at your fingernails here. Your cap refill is good. And it is. I'm going to have you go like this. Just look at your fingernails. Make sure I don't see any clubbing. That might mean you have some hypoxic issues going on. And it looks good, okay? Go ahead and test your reflexes here. I'm going to run over and grab my reflex hammer. Good. pulses on both sides here, your radial pulses. They're normal. And your brachial pulses. And they're normal. Let's do a little sensation test. Close your eyes. When you feel me touch, you tell me if it's dull or if it's sharp, okay?
Dull. Dull. Sharp. 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 Dull. Sharp. Dull.
Perfect. Okay. Next we'll go ahead and have you hop up onto the exam table, okay? I'm going to have you lay stomach first the first time, okay?
Okay.
We're going to test something called your diaphragmatic excursion. Just relax for me here. What I'm going to have you do is I'm going to get a pen and I'm going to get my tape measure. I'm going to have you take a deep breath and hold it, okay? Oh, go ahead. Okay, let it out. Now I'm going to have you take a deep breath, let it out, and hold your breath, okay? Go. This should be about 3 to 4 centimeters, and you're exactly at 4. We'll go ahead and do the other side, okay? Same process. Deep breath, let it out and hold it, okay? Okay. Same thing as last time, deep breath, let it out, and hold it. Those appear to be exactly the same. We're just kind of listening for changes in the sound of percussion. Okay? Sorry about the little marks on your back there. Clean those off at the end of the exam. Now if you'd like to, you can roll over onto your back. There we go. Now that you're kind of laying here, I'm going to have you kind of tilt your head back a little bit for me. Move your head to the side over here. I don't see any jugular vein distension. It could be indicative of some right-sided heart failure. It looks good. Like I said before, your heart sounds are normal, so I don't think there's any reason to be concerned there. Okay? We're going to move on to your abdomen. First, I'm going to listen to different arteries, okay? We'll listen to your aortic, your renal, your iliac, and your femoral, okay? And I'll keep you decent here. And I probably won't be able to get any lower there on that, okay? But your femoral and your femoral. Alright. So we'll go ahead and we'll listen to your bowel sounds, okay, in all 4 quadrants. Okay. As I'm running through this, I'm kind of looking at your stomach. I'm making sure I don't see any abnormal thrills. I don't see any heaves or pulsations that are abnormal, okay? I'm going to kind of feel for this pulse here, too. Sorry. Make sure it's about normal. It's not enlarged. Looks good, okay? We'll go ahead, we'll move on, we'll palpate your liver and your spleen, okay?
Okay.
Oops, sorry about that. I'm going to start over here with your liver. Just going to kind of make sure it's within this 5 to 6 centimeter area. It's not enlarged. Sorry, can you go ahead and breathe in and let it out. You're a little stiff. Really let it out. Okay. I'm going to do deep and wide. And I can't palpate it, which is normal. Alright, move over to your spleen, okay? Same thing. Or do light. We'll do deep. I'm sorry if that's uncomfortable. It doesn't hurt though, does it? Okay, and we'll go ahead, we'll move on to your abdominal muscles. We'll palpate there. Light and deep, same thing. Shouldn't be tender, but you'll feel me kind of feeling around. Okay, and deep. Can you let that air out? You're really holding your breath. Your bladder doesn't feel distended, but you went to the restroom before the exam began. Okay, and that all feels normal, okay? So we'll go ahead, we're going to percuss your liver and your spleen, okay? So I'm going to start up here to find your liver border. We'll listen for changes in sound with this percussion. And there's your liver borders. Looks like it's right within normal. The same thing over here with your spleen, okay? You kind of feel around. I have a hard time finding this one. Okay. Appears to be normal, okay? No abnormal dullness or anything like that. Okay, so I think we'll go ahead and have you sit up. To your legs here, okay? I'm going to go ahead and feel for your pulses. For dorsal pedis pulse. Sometimes it can be a little different place on people. Good. Good. Your pulses here. Feels regular. Feels regular. I'm noticing while I'm doing this that your hair distribution is normal. You don't have any swelling, abnormal color. Feeling for your popliteal pulse back here. Good. I feel that just fine. We'll do the same thing down here that we did before with sensation. When you feel any touching, you tell me if it's sharp or if it's dull, okay? Close your eyes.
Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. 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 Dull. Sharp.
Good, okay. So we'll go ahead and we'll do your reflexes now, okay? Just kind of get your leg loose for me. Let it dangle there. Do your Achilles reflex. Good. And same thing over here. Just kind of get your leg loose for me. Good. Get your leg loose for me here. We'll get your reflex in your knee. Good. Good. Now we'll go ahead, we'll do cervical and thoracic, range of motion, things like that, okay? First thing I'm going to have you do, lean your head back and touch to your chest. Good. Side to side, ear to shoulder, good. And then just kind of rotate your head for me. Good, that looks normal, normal range of motion. Now we're going to do it against the resistance of my hands, okay? So side to side. Okay, front and back. Good, and then rotate it. Good, perfect. Okay, now we stand up. Gonna have you lean forward and touch your toes. Good. And I'm just gonna have you lean back. Good. So then we'll do side to side. Good. And then rotate it there. Good. You can go ahead and sit down. And I think that concludes our exam. Any questions?
Nope.
All right. See you next year.
See ya.